Refugee settlement and health workers are trying to figure out how to best help the thousands of new refugees expected to arrive in Canada in the coming weeks. So what kind of medical issues could these refugees be facing? And how ready are health workers on the front lines going to deal with all of this? Dr. Ashna Bowry is a family physician at St. Michael's Hospital in Toronto. She provides primary care to refugees and helped start a Syrian refugee clinic in the city. And she joins us now here in studio. Dr. Bowry, thank you for coming in. We're talking about 25,000 refugees coming into Canada soon. What are the greatest concerns when it comes to what their needs will be when they arrive?
Hi, Rashmi. Thank you very much for having me today. I think what's unique about this situation is this is an unprecedented number of refugees that we're going to see coming into Canada at this time. Each specific refugee group that comes into the country has different unique needs. But what we expect from this group of refugees is in many ways no different than others. There would be immediate needs, things like addressing injuries from their journeys thus far, addressing neglected chronic diseases, diabetes, blood pressure control, which may not be at its best due to disrupted medical care. Certainly thinking about mental health concerns, post-traumatic stress disorder, relapse of pre-existing mental health problems will be important to think about. Looking at vulnerable populations, children, child health, making sure vaccinations and their growth and development is appropriate given the trauma that they've experienced. There are lots of things to think of in terms of their immediate needs, but of course further down the line thinking about the social determinants of health, adequate housing, integrating these people into their communities will be important for their health as well.
Yeah, and are you worried about diseases like tuberculosis or any sort of health afflictions they might have picked up on the way?
So at this point, there are no indications that this group of refugees pose any risk for any specific infectious diseases. TB is something that comes to light quite often in these situations, and the information we have is that the risk is extremely low at this time.
Okay, that's great news. And so you've started a clinic specifically for Syrian refugees. How prepared do you feel?
So we came to the table, so St. Michael's Hospital came to the table with Women's College Hospital, Access Alliance and Queen West Community Health Centre before the election, so in early September, to bring our expertise together to see how we could prepare. Of course, at that time we were looking at hundreds to thousands, not tens of thousands of refugees. But we have set up a clinic to rapidly process refugees coming into the GTA and the inner city to act as a gateway, essentially, for them to access the services they need.
On a political level, federal, provincial, even municipal, is there anything that can be done to make this process go smoothly?
In fact, when we're looking at such a large number of people coming in, it will need coordination from a federal and provincial level. In fact, at this moment, we have very little direction on how those health services are going to be directed, and we're waiting for direction from our health leaders.
Okay. Are you hopeful that you'll get that direction soon? I mean, time is of essence here now, isn't it?
Yes. No, I'm very optimistic. There are a lot of people working behind the scenes on all levels to try and make this happen. I'm very optimistic. Through this planning process, people have crawled out of the woodworks from across the GTA to offer their support. I'm a newcomer, I'm a new Canadian, and I can say that's what makes me proud to call Canada home, our ability to provide opportunity for newcomers and welcome them as one of our own.
Well, thank you for coming and joining us to speak about this.
Thank you very much for having me.
Thank you. Dr. Ashna Bowry, family physician at St. Michael's Hospital in Toronto, providing primary care to refugees.